Hello and welcome to this T-Level Health Mastering Infection Prevention Strategies for Healthcare Excellence. Welcome to our session on infection prevention and control. In healthcare settings, it is crucial to implement effective strategies to minimise the spread of infections. Today, we'll explore the essential techniques and practices that help safeguard both patients and healthcare workers. Effective infection control techniques are paramount in safeguarding both patients and healthcare workers. Let's explore some essential strategies such as proper hand washing, use of personal protective equipment or PPE, and safe disposal of sharps that play a vital role in preventing the spread of infections. Proper hand washing techniques adhere to specific guidelines to ensure thorough cleansing and reduction of the risk of spreading infections. Here's a breakdown of the recommended steps. First, wet hands with water. Start by wetting your hands with clean running water. Adjust the temperature to a comfortable level. Next, apply soap. Dispense an adequate amount of soap into your hands. Use enough to create a good lather for effective cleaning. Thirdly, lather hands thoroughly. Rub your hands together vigorously to create a soapy lather. Ensure that you cover all surfaces of your hands, including the backs of your hands, between your fingers and under your nails. Scrub for at least 20 seconds. Rub your hands together for at least 20 seconds. This duration is crucial for effective removing dirt, germs and pathogens from your hands. Next, pay special attention to key areas where pathogens are likely to reside, such as around the nails and the tips of the fingers. Rinse your hands thoroughly under clean, running water to remove all soap and lather. Ensure that all soap residue is washed away. Use a clean towel or air dry to dry your hands thoroughly. Ensure that your hands are completely dry as moisture can harbour germs. And finally, use a towel to turn off the faucet to prevent recontamination. In addition to these general steps, UK hospitals often follow specific hand washing techniques endorsed by organisations such as the National Institute for Health and Care Excellence, or NICE, and the World Health Organization, or WHO. These techniques may include the ALIF hand washing technique, which emphasises thoroughness and coverage of all hand surfaces. Adherence to proper hand washing technique is critical in UK hospitals to minimise the risk of healthcare associated infections and ensure the safety of patients, staff and visitors. Regular training, reinforcement and monitoring are essential components of maintaining high standards of hand hygiene in healthcare settings. So in UK hospitals, the correct use of personal protective equipment is essential to minimise the risk of exposure to infectious agents and ensure the safety of healthcare workers, patients and visitors. So here's a detailed overview of the recommended practices for the correct use of PPE. With gloves, you wear disposable gloves when coming into contact with blood, bodily fluids, mucus and membranes or contaminated surfaces. Choose the appropriate size to ensure snug fit without being too tight or too loose. Put on gloves before performing any procedure that may involve contact with potentially infectious materials. Ensure gloves cover the wrists and worn over the cuffs of the gown or garment to prevent exposure. Change gloves between patient interactions after handling contaminated materials and when moving from one task to another. Face masks. Wear a surgical mask or respirator when caring for patients with respiratory infections or when performing procedures that generate aerosols. Ensure that the mask covers both the nose and mouth and fits snugly against the side of the face without gaps. Replace masks if they become moist, damaged or visibly soiled. Remove masks by handling only the ear loops or ties. Avoid touching the front of the mask. Dispose of single-use masks in designated waste bins after use and perform hand hygiene immediately afterwards. Protective eyewear or face shields. Use protective eyewear or face shields to protect the eyes, nose and mouth from splashes, sprays or droplets of infectious fluids. Wear goggles or face shields that cover the front and sides of the face when performing procedures with the risk of splash or splatter. Clean and disinfect reusable eyewear or face shields after each use according to the hospital's protocol. gowns or aprons. Wear gowns or aprons to protect clothing and skin from contamination during procedures that may generate splashes, sprays, or droplets. Choose the appropriate gown or apron based on the level of anticipated exposure to infectious materials. Ensure that gowns or aprons cover the torso, arms, and front of the body adequately. Remove gowns or aprons carefully without contaminating clothing or skin and dispose of them in the designated waste bins or laundry hampers. And finally, respirators. Use respirators such as N95 or FFP2 masks when caring for patients with airborne infections such as tuberculosis or COVID-19. Follow fit testing procedures to ensure proper seal and adequate protection against airborne particles. Replace respirators if they become damaged, soiled, or difficult to breathe through. In addition to wearing appropriate PPE, healthcare workers must receive training on how to correctly don, doff, and dispose of PPE to minimise the risk of self-contamination and transmission of infections. Regular education, reinforcement, and auditing of PPE practices are essential components of infection prevention and control in UK hospitals. In UK hospitals, the safe disposal of sharps is crucial to prevent accidental injuries and transmission of infections amongst healthcare workers, patients, and visitors. Here's a detailed overview of the recommended practices for the correct disposal of sharps. First, sharp containers. Use puncture-resistant and leak-proof sharp containers specifically designed for the safe disposal of sharps such as needles, syringes, lancets, and scalpels. Ensure that sharp containers are placed in easily accessible locations near areas where sharps are used and disposed of, such as patient rooms, treatment areas, and laboratories. Select the appropriate size and capacity of sharps containers based on the volume and type of sharps generated in each area. Immediate disposal. Dispose of used sharps immediately after use to minimise the risk of accidental injuries and exposure to infectious materials. Never recap or bend needles by hand after use, as this increases the risk of needle stick injuries. Instead, dispose of needles directly into the sharps container with one-handed techniques. Proper segregation. Separate sharps from other waste materials at the point of generation to prevent accidental injuries and contamination. Do not dispose of sharps in regular waste bins or bags, as this poses a risk to waste handlers and can lead to needle stick injuries. Fill level and closure. Do not overfill sharp containers beyond the maximum fill line indicated on the container. Once the sharp container is full or reaches its fill line, securely close and seal the container to prevent spills or accidental openings. Transportation and handling. Handle sharp containers with caution to avoid punctures or spills during transportation. Use trolleys or carts equipped with secure holders to transport sharp containers safely from point of use to central collection points or disposal areas. Disposal procedures. Follow hospital protocols and local regulations for the disposal of filled sharp containers. Arrange for regular collection and disposal of filled sharps containers by authorised waste management companies or healthcare facility staff trained in hazardous waste handling. Maintain accurate records of sharp disposal activities, including dates, locations, and quantities of sharp disposals. Document any incidents or near misses related to sharp disposal and implement corrective actions to prevent future occurrences. By adhering to these guidelines and best practices, healthcare facilities in the UK can minimise the risk of needle stick injuries and ensure the safe disposal of sharps, thereby protecting the health and safety of healthcare workers and the wider community. Time for a quiz. What are the recommended steps for proper hand washing in UK hospitals? A. Wet hands. Apply soap, scrub for 5 seconds, rinse or dry hands. B. Apply soap, rinse hands, dry with a towel. Or C. Wet hands, apply soap, lather thoroughly, scrub for at least 20 seconds, rinse, dry hands. The answer is C. Wet hands, apply soap, lather thoroughly, scrub for at least 20 seconds, rinse and dry hands. When should healthcare workers wear gloves? Only when performing surgical procedures? only when handling hazardous chemicals, or when coming into contact with blood, bodily fluids, or contaminated surfaces. The answer is C, when coming into contact with blood, bodily fluids, or contaminated surfaces. Third question, how would sharps be disposed of in healthcare settings? Recapping needles before disposal, placing sharps in regular waste bins, or use puncture-resistant and leak-proof sharp containers. And the answer is C, using puncture-resistant and leak-proof sharp containers. How did you do? So now we're going to explore the correct order of applying and removing PPE, as it is vital to prevent cross-contamination and ensure effective infection control. Let's walk through the proper procedure step by step to minimise the risk of exposure to infectious agents. First, perform hand hygiene. Before donning any PPE, wash your hands thoroughly with soap and water or use an alcohol-based hand sanitizer to remove any potential pathogens from your hands. Next, put on an apron or gown. Don the apron or gown. Ensure it covers the front of your body from neck to knee and wraps around the back. Secure the ties or fasteners at the back of the neck. Put on surgical mask where required. If a surgical mask is required, carefully place it over your nose and mouth. Ensure it fits snugly against the side of your face and cover both your nose and mouth. Secure the mask ties or ear loops behind your head or ears. Eye protection when required. If eye protection, goggles or face shields is necessary, put it on, ensuring it covers your eyes and the surrounding areas. Adjust the fit to ensure there are no gaps between the face shields or goggles and your face. Finally, gloves. Put on gloves ensuring that they cover your hands completely and overlap the cuff of the gown or garment. Make sure the gloves fit snugly but are not too tight, allowing for dexterity and comfort during patient care activities. Now, what's the correct order of removing PPE? Begin by removing gloves first to minimise the risk of contamination. Grasp the outside edge of one glove near the wrist and peel it off, turning it inside out. Hold the removed glove hand and slide the fingers of the ungloved hand under the remaining glove at the wrist to remove it, turning it inside out. Dispose of the gloves immediately in a designated waste bin. Next, the apron or gown. Untie or unfasten the apron or gown at the neck and waist. Avoid touching the front of the apron or gown. Gently put the apron or gown away from your body and roll it inside out, containing any contaminants inside. Dispose of the apron or gown in a designated waste bin. Remove eye protection by handling the templates of headband. Avoid contact with the front surface. Dispose of disposable eye protection or clean and disinfect reusable eye protection according to hospital protocols. Next, carefully remove the surgical mask by handling the ear loops or ties, avoiding touching the front surface. Dispose of disposable mask immediately in a designated waste bin. If using a reusable mask, place it in a designated receptacle for reprocessing or storage. After removing all PPE, perform hand hygiene using soap and water or an alcohol-based hand sanitizer to ensure your hands are thoroughly cleaned and free from contaminants. Adhering to this correct order of applying and removing PPE helps minimise the risk of self-contamination and infection transmission during healthcare activities. It's essential to follow these procedures meticulously and undergo regular training and practice to ensure proficiency and compliance with infection control protocols. So why are these techniques crucial? These techniques are crucial in stopping the spread of infections for several reasons. Prevention of cross-contamination. Proper hand washing techniques and the correct use of PPE help prevent cross-contamination between healthcare workers, patients and the environment. By removing pathogens from hands and using protective equipment, the risk of spreading infection is significantly reduced. Protection of healthcare workers. Healthcare workers are at risk of exposure to infectious agents during patient care activities. Proper hand hygiene, PPE usage, and safe sharps disposals protect healthcare workers from contracting infections and experiencing occupational hazards such as needle stick injuries. Protection of patients. Implementing these techniques safeguards patients from healthcare-associated infections. By maintaining high standards of hand hygiene, using appropriate PPE, and safely disposing of sharps, the transmission of pathogens from healthcare workers to patients and vice versa is minimised. And finally, prevention of community transmission. Adhering to these techniques not only protects healthcare settings, but also helps prevent community transmission of infections. Healthcare facilities serve as a focal point for disease control, and implementing stringent infection prevention measures within these settings contributes to broader public health efforts. In summary, proper hand washing techniques, correct use of PPE, and safe disposal of sharps are critical components of infection control in healthcare settings. These techniques not only protect healthcare workers and patients, but also play a vital role in preventing the spread of infections within the community at large. So let's recap. What is the correct order of applying PPE? Gloves, gown, mask, eyewear. Gown, gloves, mask, eyewear. Or hand hygiene, gown, mask, eyewear, gloves. B. Gown, gloves, mask, eyewear. Cleaning, disinfection, and sterilisation are essential processes in eliminating harmful microorganisms. Decontamination is an overarching process used to describe cleaning, disinfecting, and sterilisation. Let's delve into the scientific principles behind these processes, understand how they contribute to maintaining a safe and hygienic healthcare environment. Cleaning physically reduces the presence of microorganisms that may be present on surfaces and instruments through the removal of visible foreign material. This minimises the risk of transfer of microorganism. Procedures include cleaning tools, for example, mops, vacuum cleaners, cloths, and floor scrubbers. The use of cleaning agents, some of these may eliminate microorganisms. Next, disinfecting. Using a specific chemical disinfectant, for example, sodium hypochlorite, or by physical disinfection, for example, heat, reduces non-visible pathogenic microorganisms by destroying cell wall or interfering with metabolism. And finally, sterilisation. This is the complete elimination of all microorganisms through the application of chemical, application of high pressure, application of heat, or application of irradiation and filtration, or a combination of the two. Antimicrobial resistance poses a significant threat in public health, leading to the emergence of superbugs and reduced effectiveness of antibiotics. Let's explore the implications of antimicrobial resistance and strategies for combating it to ensure effective infection control. So what is the meaning of antimicrobial resistance? Antimicrobial resistance refers to the ability of microorganisms such as bacteria, viruses, fungi, and parasites to resist the effects of antimicrobial agents, including antibiotics, antivirals, antifungals, and antiparasitic drugs. This resistance occurs when microorganisms evolve mechanisms to withstand the effect of these drugs, rendering them less effective or ineffective in treating infections. So what is the impact of antimicrobial resistance? Overuse and misuse of antibiotics have contributed significantly to the emergence and spread of antimicrobial resistance. This has led to several consequences. Overuse of antibiotics has diminished their overall effectiveness in treating infections as resistant strains of microorganisms become more prevalent. Antimicrobial resistance has spurred the emergence of new strains of microorganisms that are resistant to multiple antibiotics, making infections more challenging to treat. Increase in superbugs. Resistant strains of microorganisms, often referred to as superbugs, such as MRSA, pose significant public health threat to their ability to cause severe and difficult to treat infections. Antimicrobial resistance requires concerted efforts from healthcare providers, policymakers, and the general public. Strategies for reducing antimicrobial resistance include antimicrobial stewardship programs, implementing antimicrobial stewardship programs in healthcare settings to promote the appropriate use of antimicrobials, including antibiotics. These programs aim to optimize antimicrobial use, improve patient outcomes, and minimize the development of resistance. Raising awareness among healthcare professionals, patients, and the public about the importance of prudent antimicrobial use, the consequences of antimicrobial resistance, and the significance of infection prevention measures. Investing in research and development of new antimicrobial agents, diagnostics, and alternative treatments to combat resistant infections and addressing the growing threat of antimicrobial resistance. Calibrating at the national and international levels to develop and implement policies, regulations, and strategies to combat antimicrobial resistance effectively. By implementing comprehensive strategies and promoting responsive antimicrobial use, it is possible to mitigate the impact of antimicrobial resistance and preserve the effectiveness of antimicrobial agents for current and future generations. Good infection control and decontamination procedures reduces the likelihood of superbugs impacting patients and as a result, support reduction of antimicrobial resistance. Let's explore how policy and practice ensure safe practice. One specific example of policy or legislation in the UK related to infection control and healthcare practice is the Health and Social Care Act 2008 Code of Practice on the Prevention and Control of Infection and Related Guidance. This legislation provides guidance and standards for healthcare providers on the prevention and control of infections within healthcare settings. It outlines the responsibilities of healthcare organisations, managers and staff in implementing effective infection control measures to protect patients, staff and visitors from healthcare associated infections. Key aspects covered in this code of practice include hand hygiene, PPE, environmental cleaning, waste management, outbreak management, and education and training. The Health and Social Care Act 2008 Code of Practice on the Prevention and Control of Infection and related guidance serves as a comprehensive framework for healthcare organisations to ensure compliance with infection control standards and regulations in the UK. Compliance with this legislation is essential for maintaining patient safety and minimising the risk of healthcare associated infections in healthcare settings. Time for a quiz. What is the purpose of the Antimicrobial Stewardship Programme? To promote the inappropriate use of antimicrobials, to optimise antimicrobial use and minimise the development of resistance, to encourage overuse of antibiotics for all infections. The answer is B, to optimise antimicrobial use and minimise the development of resistance. Next, what legislation provides guidelines on infection prevention and control in the UK healthcare settings? A, Health and Safety at Work Act, B, National Health Service Act, or C, Health and Social Care Act 2008. The answer is C, Health and Social Care Act. Next, let's explore a case study. So we're going to review the case study on the left, and in your own time, you can then answer the questions on the right, and you can then share that between your students or yourselves. So the scenario, you are a nurse working in a busy hospital in the UK. One day you notice that some of your colleagues are not following proper hand washing techniques, and there seems to be confusion about the correct use of personal protective equipment. Additionally, you observe sharps being disposed of improperly, posing potential risk of needle stick injuries. As a proactive member of the healthcare team, you decide to address these concerns and ensure compliance with infection prevention protocols. So answer these 6 questions and apply this to this scenario. So let's summarise. Effective infection control measures are crucial for maintaining the safety of both patients and healthcare workers in any healthcare setting. The key strategies we explored today were, firstly, proper hand washing techniques, which are essential for reducing the risk of spreading infections. In UK hospitals, specific guidelines endorsed by organisations like NICE and WHO are followed to ensure thorough hand hygiene. Secondly, the correct use of personal protective equipment is vital for minimising the risk of exposure to infectious agents. Specific practices for gloves, masks, eyewear, gowns and respirators are followed meticulously to ensure the safety of healthcare workers and patients. Additionally, the safe disposal of sharps is crucial to prevent accidental injuries and transmission of infections. Specific practices for the correct disposal of sharps are followed to protect healthcare workers and the wider community. Knowing the correct order of applying and removing PPE is also essential to prevent cross-contamination. Proper procedures for both applying and removing PPE are followed meticulously to ensure effective infection control. Furthermore, understanding the scientific principles of cleaning, disinfecting and sterilisation is crucial for maintaining a safe and hygienic healthcare environment. Antimicrobial resistance poses a significant threat to public health, and combating it requires comprehensive strategies and global collaboration. Lastly, specific policy and legislation such as the Health and Social Care Act 2008 play a vital role in shaping infection control practices in the UK hospitals. Compliance with these regulations is essential for maintaining patient safety and minimising the risk of healthcare associated infections. By implementing these strategies and adhering to best practices, healthcare facilities can effectively prevent the spread of infections and ensure the safety and well-being of patients, healthcare workers and the wider community. Thank you for watching.